So when we cure a kid with heart disease, when a kid has surgery and comes out of that and goes home, you all have a part of that. And so you should feel very good about what you're doing here today, because you're just as important as the surgeons and the cardiologists who are taking care of those kids. Through their generosity and through their vision and through your generosity, taking care of the kids right at the very beginning after the heart surgery, taking care of the survivors, the kids who survive, which is again most of the kids, helping make sure that they are really very supported as they go through school and very successful and become successful adults. So I'm very pleased tonight to announce on behalf of Greg and Kara and the Greg Olsen Foundation and the HEARTest Yard Foundation that the next $2.5 million raised is going to go to set up the HEARTest Yard Pediatric Cardiology Clinic in our new renovated building that's going up at Levine Children. So thank you very much. And with that gift, the HEARTest Yard will have donated almost $6 million to the children treated at Levine Children's Hospital with congenital heart disease. So that's really an amazing gift.
There's nothing like it in the southeast region of the United States. There's a handful of places around the country that offer it, and we said, okay, who's going to go out and run this for us? Who is the person that's going to bring this comprehensive aspect of care and bring it to Charlotte, bring it to Levine Children's Hospital, and separate us from everybody else in the country? And the team said, we're going to go after Dr. Nancy DeBralet, who was working at Rainbow Babies Children's Hospital in Cleveland. She ran a very similar program with one of the pioneers in this industry down in Miami Children's, which is now Nicholas Children's. And she was our first target. We brought her in, we recruited the heck out of her. Kara and I begged her to come move here, move her family here, and spearhead this vision that we had, that we could bring a one-of-a-kind comprehensive program for all cardiac babies and all cardiac patients in the region, and have that housed here in Charlotte.
The children that are born with these defects will have access to neuropsychologists, to educational specialists and educational liaison with the public school system, the private schools, mental health professionals, dietitians, speech therapists, occupational therapists, any kind of therapy that they may need. And again, the key is really supporting the families through the duration. And we would not be able to do this without everybody's support. And it will be a game changer for the children in all the Carolinas and the Southeast region.